We do high-risk pregnancies mostly. We take care of a lot of patients who have had reproductive assistance through one of the endocrinologists here in town. And we see a large number of patients because of the Med Center who have had transplants, who have had cancer treatments in the past, who've had significant medical illnesses that may impact what goes on with their pregnancy. People do a lot of things just to choose what they think is best for them too, though, and that is something that we can at least let people do here at the Olson Center. They have options of different kinds of providers that they can choose from. To be able to coordinate those kinds of multiple appointments for patients and being able to have them at a site where things can get done relatively efficiently, where you're not coming back and forth for 3 or 4 different appointments. Everyone understands what you're trying to do for the patient, and because that understanding's there, the effort is easier because you know you're doing something good in the end. We have the ability to get them into counseling for depression with our psychiatrists. We have smoking cessation, we have dietary counseling, we have a lot of things that benefit everybody. So there's a lot of different services that are available. And we have the internists to kind of do some of the stuff for our patients who, after they deliver, need for long-term follow-up too. So it's very nice. The services possible for our patients are the ability to have your medical issues, the medical care that you need provided by the same people who are taking care of you from the obstetric standpoint, whether that's medical issues for the mother herself or because there's a problem with the baby, evaluations for things that may have occurred in the past that put you at some kind of risk. We are a relatively small group of 3 maternal fetal medicine people right now. We have the ability to know most of our patients very well and be able to spend time specifically on dealing with the issues that they have because of the complications that are going on with their pregnancy. If they're in our high-risk population, they see one of the MFMs at every hospital, every clinic appointment that they come to, whether it's ultrasound or if you're a diabetic, we see them during their diabetic care. We see them in the clinic. So we see them at all their appointments. For a lot of the women who have chronic medical conditions or a prior major medical illness, it's more sitting down and talking to them about what we know in regards to that particular issue. So I guess one of the good examples from the Med Center is that the number of women we have with transplants because of the Liver Transplant Center. And so we go through with them what the history is behind liver transplantation and pregnancy, what their medications might mean to the pregnancy. Many of them don't really realize that there's potential impacts with medications and the fact that they've had a transplant. What their transplant was for, is that a chronic condition that would result in any complications in the pregnancy. So a lot of it is information sharing that they may not have ever gotten or absorbed during a previous appointment, because when you're really ill, you hear so little of what physicians say to you. And I've told patients over and over again, this is what's going on. I know that you're not going to hear what I say, especially when we're talking about fetal abnormalities. They hear something's wrong with my baby, and there's a part of your brain that starts to shut off, just like when you hear I have cancer, you can't listen to the rest of it because you're so scared at that moment. And so we go back and we address it over and over again if we need to, and give them the opportunity to ask questions repeatedly. But I think part of it is just making sure that that information is shared, that they know someone has an idea of what's going on and are willing to talk to them again and again if they didn't hear that the first time through. There are some patients that I know that all 3 of us have taken care of, and you realize one day that person relies on you more than your other 2 partners, even if it's just to see your face and know that you're part of what's going on with them and their baby right now, it's very rewarding to know that even one of your patients sees you as someone who is taking care of the issue and making sure that everything's going to be as good as possible. It might not be exactly what they wanted in the end, but it's the best possible outcome that they could have hoped for given their medical condition. My name is Dr. Teresa Berg. I'm a maternal fetal medicine physician, which is high-risk obstetrics. I went to college at South Dakota State University. I did my medical school at the University of South Dakota, and then continued my training at the University of Nebraska Medical Center for my residency in obstetrics and gynecology. Did a fellowship in maternal fetal medicine at the Medical College of Georgia in Augusta, and have been in practice at the University of Nebraska Medical Center for 14 of the 18 years I've been out of residency.